Latin, the word doctor means to teach. And in essence, I feel like today I'm going to kind of come here and try to teach you about how we got into this predicament where we are today. But think about this one sobering fact for just a brief minute. In less than a year, the federal government has basically taken over our banking industry. They've taken over our automotive industry. They're halfway to taking over our energy industry. And they make no qualms about getting more involved with healthcare, even though Medicare is a complete and total disaster.
Yeah. Well said.
That is a sobering fact. It is less than a year that this has happened. So how did we get here? How did we end up in a point where we have health insurance? And how is it that government got involved with health insurance? And like so many things in business, it's all supply and demand. So I'm going to give you a little history, and then we're going to talk about possible solutions. National health actually dates back to 1888. And I'm going to get off this real fast because that's where it started in Germany. But with the advent of penicillin, or the discovery of penicillin, something interesting happened in medicine. The demand for medicine changed because antibiotics substantially improved a patient's outcome and enabled us to have surgical procedures that prior to the advent of antibiotics were impossible. So people started to want medicine. The demand went up, and therefore the inventions of medicine went up and the costs went up. It was in the 1920s and 1930s, during the time of Social Security discussions, that there was an actual push to have a federal Medicare program, if you will. Although it wasn't called Medicare at the time, they wanted a universal government health care program. But there was not support to do it. They couldn't get it through. So what happened is, during World War II, with the advent of penicillin, workers were very scarce and the demand for medicine was actually quite high. So employers came up with a good way of enticing workers to stay with them and work, and that was to offer health insurance. And what health insurance did is it offered a business deduction to businesses, and it offered basically a free benefit that largely shielded the consumer from the cost of medicine. And as a result, the demand for medical services stayed high, invention stayed high, and costs continued to rise. It was in 1959 that the government actually made note of how fast healthcare costs were rising, and they also noted that coming out of World War II, most workers had health insurance, which left one population largely uninsured, and that was the elderly. And this was how they first got the Medicare system passed. They offered insurance for the elderly only because everybody else, for the most part, had some form of private insurance. My thumb's getting tired. Is it still on? Okay. So now we have Medicare, but Medicare was met with great resistance because, like I said, the costs were going up, and what private industry was starting to do was cut costs and cut reimbursements to hospitals. At the beginning, physicians were a small part of what was going on. So the government actually sold the Medicare program by promising hospitals that they would pay them fee for service. Whatever you charge, that's what we're going to pay you. Something the private insurers had stopped doing. And guess what this caused? It caused an abuse of the Medicare system. It caused costs to skyrocket. So in the first 10 years of Medicare, the costs were going through the roof. So the government's solution to this was to start legislating and regulating something that they basically knew nothing about. And the only way they were able to control costs was to take about 19% of the total Medicare dollars, which go towards physicians, and a small amount that goes towards the hospital, and just start randomly cutting payments. This has resulted, if any of you have elderly parents or any of you are on Medicare and have tried to find a doctor, you might notice it's kind of hard to find somebody because the reimbursement system has been cut to the point of bringing Medicare to the brink of collapse. And indeed, by 2017, this system is expected to pay out more dollars than it actually takes in. Government has completely failed us in this avenue. So, what is our solution, and how do we get around this? Obviously, we need some sort of change, and not the Obama kind of change. have 46 million uninsured in the United States. President Obama, when addressing the AMA, said we had 46 million uninsured Americans in the United States. And I know they may not teach this at Harvard Law, but if you come here illegally, you're not an American. And in that 46 million figure, at least 9 million of these people are illegal immigrants. In this 46 million, 17 million people make more than $50,000 a year, and 7 million of them make more than $75,000, with almost half of them being between the ages of 18 and 34, with over half of them describing their health as good to excellent, and for that they choose not to buy health insurance. Perhaps President Obama doesn't realize this either, but in America we have this little thing called choice. Now, personally, I believe that we should have a system that would help people get health insurance, because sometimes we don't always make the best choices, and it's really devastating, and I see this all the time, where really healthy people, something horrible happens to them, and they get saddled with huge bills. But we can contain cost in medicine. We have seen the companies step forward and say that they can save hundreds of millions and billions of dollars if we're willing to work with them. But they all say the same thing: we do not need any more government involvement. Let me make this clear: in over 50 years of government involvement, our government has completely failed to contain healthcare costs. But in 4 years, Safeway managed to keep their costs down, actually flat. Now let me get this straight. In a 4-year period where healthcare costs have gone up by 38%, Safeway's costs have been flat. And they have done this by asking employees to have some personal accountability. Over 70% of healthcare dollars can be directly traced to modifiable behaviors. Cardiovascular disease, cancer, diabetes, and obesity are our biggest problems in the United States, and every one of these is largely modifiable by behavior. So Safeway went along and they said, okay, if you behave well, you will pay less for your premiums on a total of about $800 per individual or $1,600 per family. And in 4 years, one corporation did something that the federal government failed to do in over 50. Now, why don't we need government involved? Because one, private industry can do it. We've proven that. Another example from private industry: the Medicare drug benefit program was estimated to cost $74 billion. Well, guess what? There's 1,300 insurance companies out there. About 100 of them decided to get involved in distributing drugs to seniors, and the competition amongst these groups cut that cost by 48%. It went from $74 billion to $44 billion. It's competition. It's not government. We have to get this message clear. If we have a government option, government has no competition. As it is right now, their underpayments are costing you individually about $1,800 a year in unnecessary taxes. $1,800 a year in unnecessary taxes to support their broken system that they want to expand to everybody. Just making sure I've covered everything here. Absolutely tort reform, but you know Obama, he's a lawyer. Let me tell you, insurance companies sue physicians knowing that we have no time to deal with it. They look for small amounts. They aren't all $1 million lawsuits. They're 10,000 here, 20,000 there. It gets to the point where it's not even worth defending it. Sorry. An anesthesiologist is sued on average every 2 years. I'm sure I've got one out there somewhere. I just haven't seen it yet. We need tort reform. We have it in California a little bit, but you know how the lawyers get around it? They don't sue us for malpractice anymore. They sue us for elder abuse, which has no caps.
Loser pay! Loser pay!
That would be good, but they're not fighting it. We do need tort reform, and Obama said to the American Medical Association, I watched the whole speech, I wasn't in the OR that time, I do not support malpractice caps. And until we change that, we're going to have big, huge problems in medical care. But I think it's very, very clear we can